Resolution has been prepared. This is a copy of the final plat. And
Which
what
is
we're
the same
looking,
as this, I presume.
we're looking for today is approval from you and acceptance of Stony Arch Estates second edition final plat. Everything is in order in respect to the subdivision ordinance. NACOS with Fairgram has touched all the bases in respect to the plat, and so it is all in order. Just simply needs your approval. Basically, what you're looking at there is the same thing as what the preliminary plat showed. You have 13 lots total. 11 of them are new. There were 10 that were involved in the new part that you granted the land use change for, and there was reconfiguration of 2 lots that were in the first edition. And there's now 3 lots made out of those 2 that were there. So everything is in order and it's ready for your approval if you so desire.
Motion.
Do you think the town will annex you guys in sometime down the road or no?
We doubt it, but we don't have any way to know. They've never approached us to adopt it or anything like that.
Did you print the resolution?
But you're hooked to their sewer or no?
Print the resolution?
You're all in your own.
2 acre
Want me to
parcels,
print it?
water.
I gave them each one.
Oh, they have one? Okay.
Yep, I did.
I want them to sign one of them for you today.
Yeah.
I think there's water out in that area, correct? Because the county home is on that. There are also sewer lines running out that way? I thought there was.
Yes.
Okay, but again, with the bedrock, it's gonna be pretty hard to do.
It's quite a ways away from this section. It goes through the mom's parcel that goes around this, but both lines are fairly far away, so it's pretty costly getting to them.
You bet.
For the number of lots that we have.
Yeah, it's fairly costly getting it out to the county home too, so, yeah. Okay, well, we've got a motion to approve the final plat by Gary, seconded by Tracy. All those in favor, it is a resolution. Resolution.
Yes.
Okay.
Seaman,
Tim Primer, aye.
And then if we'd sign that resolution form.
Want this one signed?
Here's the signed copy by the engineer,
Oh, I just signed
if
one.
you'd like that one.
You only want one copy now. Alexa, do you take 1 or 2 for one? Okay.
You're signing something different, aren't you?
Yeah.
Okay.
I give them that one, 'cause that's my.
Do you want to deal with this right now?
You have to memorize that, because this is what I always give her. And then Melinda is here, if we catch her.
I'll give these
I
back
think
to
just
Mike.
one, what I was hearing her say.
Yep, one. And then
Only need one?
if you catch Melinda, she can do the treasurer's certificate, and then you should have everything you need tonight. Yep. I'll give you Matt back.
Those are just extras.
There you go, Mark, there's the resolution.
This is the signed one?
Yep.
Great.
You should have everything, Mike. If you check with Melinda, she can do the treasurer's certificate. I just had a different form than the surveyor used, so,
Okay.
but Lexa's used to ours too.
Did they get a copy of a signed plat, certified plat?
I only had the one signed, didn't we?
I gave him that one that you signed, right?
Yep, yep,
I
he's
did.
got the
I gave him
original.
one.
So you want that one to be recorded.
Very good.
Thank you,
Mike and John, thank you.
Thanks, guys. We get all our ducks in a row, kind of.
Yep, yep.
Thank you. Well, Alexa, we're just a minute or two behind, but You're at the bat.
Well, I'm here to ask, I guess, or I don't like to say tell, but I would like to open my northeast window for my customers. There's nothing there to block it. It's like accessibility. I have a little buzzer that they can buzz, and the window, I can leave a little gap, just kind of like a screen shield, basically, and they could walk through and work with me that way without having to come through the door. I mean, it's not that big of a deal, but like, for example, I had a gal who had 3 small children with her the other day, and I kind of got some grief at the door. What's she gonna do with the kids? Well, she's probably gonna have to bring them in. They're little, you can't leave them out in the car or outside. So this way, she would just, I would say, walk around in the northeast window and do your stuff.
Have you visited with maintenance about this?
Yep, I kind of talked to Justin about it the other day.
And Rick? No?
And Rick wasn't here,
Okay.
but,
Okay. I'm just a little concerned as far as maybe some liability issues, doing something like that. We don't have a sidewalk going around there. So, not that
I mean,
people
I don't-
can't walk on grass, but,
Yeah.
that's a little concern. We've only got about 3 weeks before we talk about this again,
I know, but I just, if this is gonna continue, since we've already, I've been a team player, and I was asked at the beginning, are you okay with appointments for 60 days? And I'm like, yeah, sure, And then I just, it's gonna go, now it's going on for 90, and is it gonna go on again for another 30 after that? So that's kind of what I was,
Yeah.
why I was doing it. I was just gonna do it for 30 days and see where we're at, revisit it again at that time.
Why couldn't we get one of them rubber mats? I could ask Randy Jensen that was laying out here that they keep the trucks on.
Around the gravel.
Yeah.
Okay. How are those when they get wet?
They got them grommets on it, so for traction.
Or do they?
Yes, I do.
Okay. Well, I'm just, the reason, and correct me if I'm wrong, we went with this in the first place was so that we could serve Benton County residents. And I realized, at that time it was, well, what do I do about people coming in for passports? And now it's, of course, they're doing their licensing for hunting and deer licenses, is that correct?
Well, yeah, that's not, we got other stuff too,
Well, you got boats.
renewals and
Right,
things
right,
like that.
right.
Marriage licenses that you come to pick up, which that was that gal the other day. So,
So
it's, I don't mean to downgrade other offices that don't have customers, but we have customers. We're
Right.
here to serve our customers.
right.
What office doesn't have customers?
A lot more
The
customers, I guess.
custodians?
A lot more customers, I should put it that way. Yeah.
Yeah,
I would
there's,
say you're number 2, probably vehicles are number 1.
Yeah. That floor, anyway.
Yeah.
Yeah, Rick, if I could say something. First of all, if you do something like this, you take the courthouse security gains that you've made and you basically disregard them, because now you're allowing folks up to a window with no checkpoint or anything else. The other thing you need to be worried about is premises liability. You're taking people, even if you put those mats down, the ground isn't even. It hasn't been graded for a sidewalk. It's actually a big deal if someone slips and falls or trips or whatever. And you're gonna have all kinds of people. You're basically a business invitee is what the term is under the law, and you're responsible to make it reasonably safe. I don't think just putting a mat down, even if that'll give you traction, but the elderly person that trips, whatever, you're gonna look at claims or the possibility of that. And this is something that, quite frankly, if you're gonna consider it, it should be run through the courthouse security committee, because it's a big deal to what you folks have been doing in that area.
There's no doubt, that is correct, and being on that committee, I would, as you are, and Melinda, you know, I'm sure that it'd be wise to go before them to get a blessing on that, because I guess I never even thought about circumventing the security system, but, and I do understand trying to serve the public. You know, that's why did the county residents only and by appointment, and I understand that the elections, you know, it's pretty tough when people want to come in and vote. It's pretty tough to do that by appointment. So this election's kind of a smaller one, isn't that correct? But as we get towards,
I still have people filing paperwork for the general election though.
do you? Okay. So I mean, there's gonna be,
And they can come in and request absentees still by person.
I guess I just wish that, I know we were supposed to be in charge of our own offices, I just wish that if I wanted my customers to be able to come in, they could come in.
mhm,
Because I've got my screen shields, I've got my masks,
right.
they wear masks.
And I do agree that you are in charge of your office, but your office is within a county building. And if there was a accident, you know, lawsuit, they're not gonna sue just the recorder's office. They're gonna take the county. And so that's,
Well then, can I have my customers come in the door and I won't open up my window?
You have that already with appointments.
I mean, if somebody walks up to the door, I have lots of people that walk up to the door.
If you're not busy, make them an appointment on the spot.
I thought you were talking about maybe putting a phone number up and having them call.
Well, they do,
Okay,
yeah.
so what's the difference there, I guess?
Oh, I don't know, I just get a lot of people that come up that don't need to go through all that.
They don't read the
You know.
phone number?
We're not the only county doing this.
Oh, I get that.
I know there's a lot of counties that are open though too, I've looked too,
Mhm.
so. I just, you know where I stand, I'm ready to serve and I just feel like if we've got our screen shields up, everybody's protected, everybody's wearing the, you know, we're ready. So let's go another 30 days, but let's not keep going on and on. I mean, I think Haley will agree with me.
I
It's
think
time to
that'll-
open.
That'll depend on, you know, recommendation from the Public Health
Yeah,
Committee or Board.
I know.
And, you know,
I think our percentages of cases is small for our county.
correct, and that's why we kept
Our
it
grocery
to
stores are
county
open and our
residents.
gas
Well, a
stations
couple
are
days
open.
ago, statewide, the people that were getting tested, the rate of positive tests were coming back over 10%, which is a number that they do not like at all.
Yeah, and I do know that,
That's on the wrong side of the direction we want to be going.
It's
But
fine.
You
I'm
just don't
done.
have time to go
It's
down and let them in and
the
out.
people that always want what they get, but the ones of us that do don't, so it's fine. Whatever.
thank you.
Wow. Professionalism.
It is
display here.
9:15. Melinda, did you have any input? Okay, no input, just came to listen. Okay, all right, very good, thank you.
I understand how it would work for her office, but I wondered about the liability was all with the.
It's called premises liability, and it's a big deal.
Yeah, you see, I would actually think we'd want to run that past Heartland to see if there's anything with that, you know, coverage wise, but
You have coverage, it's just they're gonna say,
We talked
there's
about
a
it,
reason why you don't do that.
we talked about it with our office too, but
your office would be very
Our-
handy to do.
the problem is what we could do at the window and then what the people wanted to do at the window were gonna be two totally different things.
Okay,
Yeah, we're already thinking ahead about when we open back up, how to handle stuff, so.
and I've had a lot of input, well, I wouldn't say a lot, the phone doesn't ring every day, about opening the courthouse, but I've had input about opening it up. And they understand that Benton County residents only, they understand that, but they'd like to have that freedom of just walking in.
I don't think anybody disagrees with that. I wish that we weren't doing it this way. But I wish that because I wish we didn't have a problem with a virus. You know, there's a prudent way of doing business and then there's a throw caution to the wind way. And the steps this board has taken have been correct and have been wise. And to just all of a sudden abandon that at this point where we don't know where this thing's headed doesn't seem to make a lot of sense.
Well, I think that the rate of coronavirus transmission and coming to the window outside is going to prevent that. But if there's a liability issue as far as going around, but I'm not against having her open a window and take care of business, but if there's a legal issue, we gotta take care of it. But I mean, as far as the sidewalk, we can make it temporary, and if there's some older person or somebody that's in a wheelchair or something, and they don't want to go out there, they can go inside the building.
They can still come inside the building. I believe she posted her phone number on the door, you know, where they could call, and if she's got the moment available, they can come right in.
I think
What's the, if I could, so if you did something like that, what's the duration of the year that's gonna be closed? If you're gonna do it, you need to go out there and grade it, and you need to actually do a sidewalk. You just can't, no offense, you just can't go down over a mat. And the insurance company will tell you that as well. And, you know, it's a lot of work. By the time you've got it done, also you're bypassing security committee and the security aspects of having checkpoint security, you know, funneling folks in through one entryway. By the time you do that, when do you close it down due to inclement weather when it gets cold? Because you're not gonna wanna do it once it gets slippery out there.
Well, when, you know, Alexa approached me about this, to be very honest, I thought it was a good idea. I really did, until I stopped to think about it, you know, and the potential for liability, you know. Didn't even think of the security aspect, you know, but, yeah. So, yeah, it's more of a liability issue.
And, you know, I just say it, and anybody can come back at me if they want. Some offices are busier than others. That's not one of the real busy offices in this building.
well, it's going to get busier because deer licenses are gone.
And it's not as busy as what everybody's acting like it is.
Well, I understand serving the public. I do. That's why we're here. We're also here to protect the public. And do a little CYA in the process.
Oh, one other thing, and I wish I would have said it while our recorder was still here. And I think everyone's aware of it, but I think it just needs to be said. Been over 1,000 people died today in this country.
Per day.
Over 1,000 per day right now. It's been like that for over 2 weeks, longer. This is a serious thing.
I think there is some discrepancy between the reported cases that are dying and whether they're actually dying of coronavirus or something else.
Yeah, Gary, you might want to check that. It's over 1,000 a day.
Well, that may
And
be.
we're over 170,000 since this thing started.
Oh,
And this
thank
ain't-
you, Melinda.
and This ain't the flu.
All right, but we really need to be moving on here. We're running behind with these gentlemen. So, if you could actually hand those out, if you could tell us your name, please.
Sure, absolutely. My name is Gannon Druid, and this is Roger Chanel. We're with corrosion compliance.
And that's the county attorney, got one for me?
There you go.
Thank you.
Today we're really an organization that works with counties and entities on HIPAA compliance. And today is really about breaches and incidents that have happened in Iowa and around the nation. Just from an educational standpoint of where your risks lie from a HIPAA perspective. We can kind of jump right into it with Dallas County, Iowa. They experienced, excuse me, a data breach of nearly 4,800 people. happened from a contracted refuse company accidentally dumping PHI into the garbage. And all types of information, include name, mailing address, birth.
PHI, personal health information?
Protected health information.
Or protected health?
Yep.
Okay. All right.
Yep.
Yeah, we're not privy to some of these.
No, I apologize. Yeah, that's no problem. That actually happened late last year. Department of Health and Human Services was able to contact all those parties, and it doesn't sound like that was used for any wrongdoing. But no, those are some of the situations that counties are running into from a process and procedure of destruction of material correct way. We can hop to the next page. Worth County, they're having individuals impersonate county health, individuals going door to door, really asking questions and had knowledge of people's personal health information and whether their diagnosis and or it's asking to help them. There's no confirmed rhyme or reason or how they got that information, but it's typically collected either from the garbage, from a phishing email, or other ways that a bad actor would perform those and leverage to try to steal opioids or catch people in.
Sure.
Cerro Gordo had a very similar situation. Issued a public warning. They were impersonating health and human resources people to try to collect information and leverage those items as well from prescription drugs.
Same date. Yeah, looked like they were trying to canvass the state.
Yeah, right. Other county breaches outside of Iowa, Skagit County, they inadvertently placed money receipts of 7 individuals on a publicly accessible server. The Office for Civil Rights investigated and found that the breach affected over 1,500 individuals. The results of that situation is $215,000 in fines, and then the corrective measures required to submit annual reports to the Department of Health and Human Services. So once a breach happens like that, they're kind of a bullseye on their back for the offices that have to report to. Similar situation in Los Angeles County. With the process and procedure of removing previous individuals from the systems, they remained having access for over 3 years after they were fired and let go, which ultimately ended up in them accessing an individual's personal protected health information. And they also failed to report 131 missing and stolen IT equipment as well. That is currently under investigation too on how they're in a class action lawsuit. Mecklenburg County, North Carolina. The size of the breach was about 1,200 items. This came actually from Channel 9 doing an investigation from a abnormal pap smear results. Without the correct training, they released information on those individuals that was not allowed and obviously breaks HIPAA compliance. Actually included a detailed description of why they visited. Kern County, there was 1,200 documents. When the administrative department relocated, they ended up leaving some information out during the construction work taking place. The Kern County staff actually came back and found that information. It was left unprotected under HIPAA compliance laws. Contained their name, internal record number, service codes, and even mental health services identifiers.
So basically, what you're showing us is not only Iowa, but nationwide,
Right.
the things that have happened.
Yeah.
So there, if I can jump in for a moment, there are a couple of things that we're trying to sort of impart to you about this. One is it is nationwide. It is happening here in Iowa. One of the other things is that when people think about breaches, they tend to think about incursions into their technology. And most of these breaches, and most of the breaches that you'll have to address are actually people and processes. Only about 6% of all breaches are technology breaches. The rest of, let's say, are people and processes. Now, technology breaches get all the press because when there's a breach, it's millions of records. But the point is that you need to be thinking about your people, your processes, and your training. The other thing that we want to point out is that these are breaches that had to be self-reported to OCR, Office for Civil Rights. It's one of your obligations is that you self-report these breaches, and in the breach where 7 records were reported, but there are actually 1,500 records that were breached. The Office for Civil Rights, which is what we need to address at the federal level, has come out and finally said that the fines and penalties that they apply are based upon your attempts to keep breaches from occurring and how well you remediate them once they occur. It's not the size of the breach, it's your intent and efforts to keep breaches from occurring. They recognize all breaches can't be stopped, so they're looking for a best effort. So, with that having been said, and we can jump in on your question.
No. What you're showing here isn't like you had indicated, a lot of it is human error. Not necessarily something that just technical, that somebody, got into your computer system and stole all that information. Looks like human error, throwing it out in the dumpster, et cetera.
Right, and the root cause that the regulatory agencies have tagged virtually every breach to is inadequate training. So organizations will, once a year, they'll go on the internet, they'll train everybody. Here in Iowa, you have ISAC, that if you're part of their program, they'll take 2 people into their, I think, spring school and do training, and that sort of train the trainer, and then people come back, and they're supposed to train the rest of the staff. The regulations require that all workforce members get some level of training. Not everybody needs the same level because there are different exposures to the information. Also want to point out that while we're here today talking about PHI, protected health information, there's also PPI, protected personal information, social security numbers, driver's license numbers, bank numbers, anything that will promote an identity theft. So you need to be concerned at the federal level with those, plus some others, like the Federal Trade Commission has regulations, but also the state has its own set of regulatory requirements. The good news is that if you're complying with the HIPAA regulations, we can have a discussion about, for better or worse, what that means, but you are going to be complying with all the other regulations you need to worry about. So it is a situation where one peg does fit all the holes. So.
Well, I interrupted you, so go for it.
Go ahead. Yeah, this is the first time Yennen's done this, so.
No, it's very good.
Feel free to hold my feet to the fire.
So,
That's great. But yeah, kind of going down, and we jump right into the, you can tell with the size of the county of Los Angeles. This is the theft of an encrypted laptop. So it's either someone leaving them in a car or someone that's being irresponsible with the information that they have. Involved protected health information, social security numbers, demographic data, billing information, dates of birth, and medical diagnoses. That's actually currently in a class action lawsuit. Alleged patients weren't notified, so that's that best effort of trying to figure out what information is left and notifying the individuals.
and the value of a record in a class action lawsuit today is $3,000. And the median size breach is 3,500 records. So we're talking about significant civil liability along with the regulatory liability.
And then the Transportation Authority. This was a ransomware attack that shut down 88 servers for several days, which run email, voicemail, assigned payroll, and applications that that help out the transportation authority. They ended up, rather than paying the $8,500 in ransom, they opted to revamp their system. The attack ended up costing close to $660,000, including over $300,000 in labor costs, as well as $218,000 in emergency contracts with Microsoft. So those can steadily increase with the amount of information that's taken. The last is a little bit unique. In Rensselaer County, New York, a young girl was bitten by a neighbor's dog. That neighbor happened to be a county jail officer, and they ended up having access to the hospital that she went to, having inmates that having to check their health records and making sure they're being taken care of correctly, but ended up accessing her records, which kind of snowballed everything to quite a few lawsuits afterwards, because they were employed for 20 years and they were claiming that other individuals had taken advantage of that relationship with the hospital as well, looking into information, access criminal history, and personal information. So that's still ongoing with suits. Kind of the secondary roads brought into the world of HIPAA. This is unique, and correct me if I'm wrong, but this is one of our clients that we were able to get redacted information from. It's actually a child that has a medical illness a chronic medical illness that was received by the county maintenance department to ensure that the county roads would be plowed in case of a scenario where the ambulance had to make it there to take care of the child. It's a little unique in that department would otherwise typically not deal with HIPAA compliant information, but it's important to note that there are some kind of trainings happening with those individuals to keep that process and procedure in place.
Let me jump in for a
Yeah, there you go.
second. So we work with a lot of different counties here in Iowa. I think we have 17 county clients and a couple of behavioral health regions. And the challenge that we always have when we're talking to the counties is, well, not all the departments have to deal with protected health information. And the one that we always pointed out was secondary roads. Right? Driver who's driving, a truck driver who's driving a grader, what do they have to do with protected health information? And our argument has always been, well, if you're keeping employee information out at the department level, if you're dealing with workers' comp, those are all going to be protected health information files. And then one of our clients got this letter, and what we're trying to say with this is, there is not a department that isn't immune. This letter had protected health information in it because it had the patient's name, their address, their diagnosis, and there was a legitimate letter saying this individual is medically unstable. So if there's a snowstorm, if you're grading a road and they call you up, you need to make sure that you can make a priority to get this individual's road open because they may need to get to the hospital. So it's one example of where a department where we may think they're not going to be exposed to PHI, protected health information, in fact, will be. So there's been some noise going around through ISAC that the counties can segregate out different departments and not worry about, whether they comply with HIPAA, but then I go back to the idea, it may not be protected health information, it may be protected personal information. It may not be the federal laws that you're going to breach, but the state laws. So you need to, as a way of protecting your citizens and their information, you really need to have a robust county-wide kind of privacy and security program.
And the next is an example of a response to a complaint made from the Office for Civil Rights. It goes into detail on what the complaint was, and really how those things are being considered from the regulatory standpoint, and what steps, and it shows a little bit of detail of the best efforts to try to overcome those situations to then become compliant again.
So again, we put this in because people hear about, well, maybe we'll get audited, what's the chance of being audited? And quite honestly, while there is a federal program to randomly audit organizations around their HIPAA compliance, the chance of being hit by audit is almost zero. And last year they did 300 audits across almost 3 million different covered entities. But in this case, this is actually one of our clients, someone filed a complaint. And so Office for Civil Rights came and investigated. They did what's called the desk audit, which is they asked for documentation. They concluded that there was no legitimacy to the complaint, that there wasn't in fact a breach, so they generated this letter, which is called technical guidance, and it says, you know, we have oversight, here's why, here's what happened, we didn't find that there was a meaningful potential for a breach, here are the things you need to do. So that's sort of the good news. They walked away without any fines or penalties. Being a regulatory agency, they're never just going to walk away with nothing. They can just slap you on the wrist. So this is their slap on the wrist. And this is the outcome we look for with our clients is no fines or penalties. That's the whole objective of having a program in place, along with protecting the information of your citizens. The bad news of it is that for 6 months, you have a target on your back. If someone files another complaint, if you have a breach that you need to report, they're going to take a deeper dive only because you've had the previous complaint. But after 6 months, that rolls off. So the objective is to make sure that you're protecting your citizens' information and you're not paying any fines or penalties, which now start at $50,000 at the federal level and go up to $1.2 million per incident. And the state has unlimited, no cap on the penalties and fines they can assess. And then, of course, you have the civil liability.
Kind of the background here, the privacy and security requirements are proliferating. The cost of fines, penalties, and civil judgments are also increasing. And really, Roger kind of touched on this, is that a lot of it is designated to overextended internal resources to develop and manage the privacy program. They're complex, confusing, and complicated. It takes training to implement and manage the programs, and one that would actually pass the scrutiny of the regulatory. The knowledge is expensive. Either you want to be able to pay them what they're worth in the market, or they'll be underutilized just from building the program here. Counties will survive breaches and complaints, not when they check the boxes, but when they apply the knowledge.
So the challenge that you're faced with is that these are complex, convoluted, and difficult, and it does take knowledge. Someone who is competent to put a program in place could walk into virtually any hospital in the country and ask for a starting salary of about $180,000, which for a county or small organization to try and match is difficult, not impossible. Add to that fact that you only need them for about 10% of that time. So the rest of the time, if you're paying them anywhere near that salary, it's an underutilized resource. So the challenge again is, how do you get the knowledge that you need to have a program that will pass regulatory scrutiny and actually protect you and do it in a cost-efficient manner? So people try and do it by assigning someone internally to manage this, who quite frankly typically doesn't have the background or the knowledge to do an adequate job. They get sort of thrown into it, and they do the best they can. I'm not knocking that, but it's like asking your bookkeeper to do your taxes. It's just a completely different skill set.
And so how we help the risk management process is conduct the risk assessments, the security and privacy risk assessments, creating a remediation plan that we help develop with you guys, and go through and correct any of the deficiencies, and then audit that program with continued training program involved. The regulatory requirements, as I mentioned, the security risk assessment, the privacy risk assessment, remediation plans in place to show that you are doing best effort to try to meet those compliances. Custom policy and procedures specific to your organization, whether it be the fire department, the police department, all the departments that are involved within the county, on how those are managed. The business associate management, so any subcontractor that you guys are utilizing to, or has access to PHI or PPI, we help manage with those and the agreements and relationship there. Oh, sure.
So business associate, we kind of jumped over that before. If you recall back to the Dallas County breach, the breach actually occurred from Human and Health Resources. They breached Dallas County's information. They would typically be classified as business associate, except if they're a governmental agency. So if your information is breached by a business associate, which is someone who uses your information to provide a task for you, you can and will be held liable for that breach. So in the case of Dallas County, they got a pass because DHS is a governmental agency. The breach we talked about where the encrypted drive was lost or stolen, that actually drive was in the possession of a business associate. And so both the business associate and the county were held liable for that breach. And in fact, the first project we did for a county here in Iowa was a ransomware attack, which ransomware attacks are designed to be, or are designated by Homeland Security and Office for Civil Rights and Human and Health Resources as being breaches because you don't know what's going on with your data while your machines are locked up. And that actually turned out to have been a business associate's machine that had been hit by the ransomware. So the point here is that to have any kind of affirmative defense when a business associate breaches your information, and all the departments are using business associates from the VA to jail and Sheriff's Department to social services, they're all using business associates, and because they're using third-party software, you need to vet them to make sure that they're complying with regulations, or you're by default going to be held liable for a breach that they cause. So what Deanna went over are regulatory requirements that are actually written in the regulations and you need to be looking at as you're putting your program together. So at this point we'd say, do you have any questions? But I want to jump over that for a moment. The page after that is just our qualifications. One of the things you need to be concerned about is this is sort of the wild west of certifications. A lot of folks out there have gone on the internet, spent an hour, paid $500, gotten some good salad put behind their name. All of our people go through certification process by organizations that have been around since the 30s and the 60s, so they're reputable organizations. It's one of the things you want to look at if you're going to have someone come in and help you, is what are their certifications, where did they actually get them, and are they legitimate? The other page has our clients here in Iowa, shows all of our counties, county clients. We also had 3 others that aren't on the list anymore. We decided that they would be better served in a different capacity. ISAC used to be one of our clients. They were a business associate to the counties. We went in and vetted them. They found some issues. We helped them work those out, and then we moved on from that. And then we have behavioral health regions. Most of our clients are in the southeast part of the state. That's where we started. And then we have other non-county clients here in the state. Our office is in Iowa City, Iowa. And then we have clients spread out across 5 other states, so we actually have a national practice. So, with that having been said, are there any questions you have about what you need to be doing and where you are now?
Well, I guess this is, basically something that we chose to subscribe to. It's a service that you provide, and there's a cost, obviously, which you don't have listed in here. But how does that work?
Well, it's not listed there because today's meeting, we just want to be educational, just kind of get into what you'd be thinking about. But since you asked, we do everything on a fixed fee basis. We do it on an annual contract. We treat all our counties the same because the work for each county is pretty much the same. Sometimes you get into a complex situation, but because we do have fixed price basis, we need the extra hours. So for a county, the first year is $14,650. The only difference would be depending on how many county employees you have to train. There is a per employee annual fee above 50. That accounts for the size of the counties that we work with. If you signed up with and that's for our most common program. We have different levels, but the counties tend, and most of our clients start with what we call a HIPAA Select, which is what I just quoted you. It's for a year. It takes about 6 months to get you to the point where you feel you can sleep at night without worrying about the ramifications of a breach. And then there's other things that we do to kind of keep self-improving through the rest of the year. It's something you have to do on a periodic basis. State of art is do it annually. So if you chose to continue after the first year, there's between a 10 and 20% discount. It's kind of like going to the dentist. First time you go in, they do all this stuff. Second time you go in, there's less to do. So to reflect that, we drop the price. It covers everything from soup to nuts, so it covers you all the way up to if you report a breach and the OCR or regulatory agency, OCR, Officers of Civil Rights, or any other regulatory agency wants to do a on-site audit, right? We don't include that in the base price because in the 7 years we've been doing this, although we've had probably 3 dozen breaches we've had to report that have been investigated, we've never had an on-site audit done, so we're not going to charge you for something we're not going to do. If you do get hit by an on-site audit, then there's another fee of $5,000 to come in. But we do everything from doing the risk assessments, doing the remediation plans, helping you write your policies and procedures, vet your business associates, do the training. You have an obligation when you have a security or privacy incident to evaluate and see if it's a breach. So we do that on your behalf. If it's a breach, we'll report it on your behalf. If there's an investigation, we put the document request together, you sign it, we send it off, respond to any questions. And again, that takes you up to the point where they're either going to close it or ask for an on-site audit. So essentially you're offshoring or offloading to us all the technical expertise you need to have to get through this. So.
Okay, very good. Questions, gentlemen?
On a breach, how long is the liability? I mean, is that 6 months, a year, if you had a breach? Or is it indefinite?
The liability doesn't go away until it's been adjudicated by the regulatory agency. It typically takes them about 2 years to get through that process. I guess rule of thumb would be, what's going to keep you up at night will last for about a year. Because typically what will happen is, as part of your remediation, you'll get credit checks on all your citizens that want it for a year to make sure that the information hasn't been used. If it hasn't been used after 12 months, it's probably not going to be used. And the definition of a breach is actually not that you had an incursion into your system, but what is the probability of misuse of that information. So the industry says that after a year, the probability is pretty close to zero because the information is perishable, not so much for medical information, but certainly for protected personal information like social security numbers, bank accounts, credit card numbers, which, interestingly enough, just as an FYI, the PPI, protected personal information, that record goes on the black market for about $5 to $7. A medical record or protected health information on the black market is somewhere between $350 and $500 a record. So there's an incentive for this information to be breached.
Okay. Other questions? Yeah.
Well, we hope we gave you something to think about. With your permission, we'll touch base with you in a couple of weeks. And in the interim, because we put our clients on the back, you know, typically what people do is the supervisor will go to one of those, counties, call up one of the, commissioners, supervisors, and talk to them. So what we'll do is, we'll actually just send you a list of people we work with. Because
I see you
save
work
you
with
a few
Worth County
hours.
for sure.
Sorry?
Worth County for sure.
Worth County's not one of our clients.
Okay.
So-
I'll have our IT guy probably, Ben,
Yeah.
be in charge of this. I mean, he works with Worth County, Joel Roney, so.
Okay.
So you'll basically save some time to just talk to people
Mhm.
about what we're saying to you. We'll also send you a little list, a kind of checklist of, these are the things you need to sort of check off to, at a 40,000 foot level to think that you have a good program in place and do what you want, and then we'll just touch base with you and answer any questions and be helpful if we can.
Thank you for your presentation, very informative.
Well, we appreciate the time and thank you.
Thank you.
Everybody's be safe.
Yeah. You will.
There's a law contract.
What's that?
It's a law.
Law enforcement? Okay. Okay, I've got here the City of Keystone law enforcement contract. Do you know if this is the same as last year?
I think they're the same price, is what Ron told us when he was in here. earlier.
Okay. Okay. There's 2 copies. There you go.
Haley, do you have a resolution which is item 8?
For what?
The CARES Act.
I have a draft that ISAC shared, but until I know the total amount, I can't fill in the amount on it, so.
Is that something I can get a copy of?
Hmm?
Please?
I've gotten pretty much everything in a spreadsheet, so I have totals, but I don't know as far as, I know Tyler was gonna look into it as well. I mean, I have like Dana's, that we paid those employees for unemployment type, but if we get reimbursed through ECOG, I shouldn't get reimbursed through CARES. So, there's some of that and then Scott made it sound like I have to do the FEMA portion before I can to go to this. I don't know, doesn't make sense.
What's the going rate of a contract per hour these days? For the law enforcement?
What is the going rate?
Is it still like $27 or $26?
I don't know what that, to be honest.
Looks like
You can divide that
It's
out.
divided
Looks
by
like about 25.
25.
Give me a second.
I think it did go up to 27.
But
Didn't he increase, was it Salzburg and Atkins to 27 maybe? I think he isolated it, how he
Really?
increased it.
Sorry.
So do you want us to wait on that resolution probably, so we can probably put an amount on it, or?
Okay. Is there a motion to approve that law enforcement contract?
second.
Okay. Tracy made the motion to approve the law enforcement contract with Keystone. And Gary seconded. All those in favor, please say aye.
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 I'll do the minutes right away.
No,
No.
we're just about ready to jump into days, so hang on.
Minutes shouldn't, I mean, it's easier to cut it off in one meeting.
Before you jump into David's, unless you want to talk about it today desperately, I would like to move the resolution and.
The CARES Act?
And yes, and the, policy regarding paying employees if they test positive. I'd like to move that to next week. I'm working on it, and I've got some good resource material, but I need a little bit more time to present it.
Okay, so item 8 and 9, you want to move on our agenda?
Yeah, unless Haley really wants to talk about one of them or both of them.
No, the resolution, yeah, we'll definitely need, because I gotta get that submitted, because the deadline is approaching, so time is of essence on that.
What's your deadline? Do you know?
September 14th or something.
I was thinking of sooner than that.
Well, I think for the one, but I think I have for the state.
We should have my end of the stuff done by next week.
So table it to 8:25, okay?
Can we do the minutes in this one quick, and then that'll finish this set of minutes?
Yep, I do have a couple things I'd like to see corrected on the minutes.
Oh, and I gotta fix the rate on, what's that kid's, that Brennan
Oh,
Hudson.
Brendan.
Ron just responded, so I changed that rate, his is like 17.49. Because I questioned why it was such a big amount. It's on the resolution for the full-time dealer,
1749.
so I changed the rate to
Yeah.
17. Is it 17.39 or 49? 49, yeah.
Okay.
So that, I tweaked that already.
Okay, very good.
I'm pretty sure it was a 4.
Yeah.
The bottom of the second page, where it reads, the paragraph, elected officials and department heads met. It says the recorder and auditor do not feel it necessary for their customers to have to make an appointment. I'd really like to indicate that the auditor said her reasoning was because of the voters, the elections, which is kind of an extenuating circumstance.
Right, I cannot deny them coming
What's that?
in. I cannot deny them to come in for that.
Correct. So I'd like to see that corrected. And then on the last paragraph regarding recent storms, I'd like it notated that the county engineer was not in favor of allowing rural residents to place debris in the ditches. So that was not indicated there. So
I just went back in there today, sorry, I haven't touched
What's
it.
that?
I didn't touch it since last week. So.
yeah. So that's what I'd like to see.
Okay.
Additions, questions? Yeah. Is there a motion then to approve as corrected?
I see on the second line of the last page, Barb Brindley reported that Should-Would talk to the DNR.
And I've not heard back, have you? You did?
No,
Okay. What did she indicate?
She sent me, the DNR sent me the link.
DNR sent you the link?
Mm-hmm.
I wonder why all three of us didn't get the link.
You checked her.
You're not special.
Evidently not.
I don't.
I'll revise those when I'm in there, because I'm gonna let Nancy
Okay.
sit in on the next part.
Other than checking on the DNR portion, are you okay with changes?
I don't understand Should-Would.
Well, that's probably just a typo. I'm not perfect, Gary.
I know, that's fine. Nobody is.
That's why you're supposed to look them over.
Is there a motion to approve?
Or do you want to wait until I bring them back revised, or as revised what you mentioned?
Do that.
Okay.
Throw them into next week's.
No, I'll get them fixed because I want to
No,
get them
just
fixed.
do it now.
Yeah, I'll fix those quick. Yeah.
I'll make a motion.
Okay.
Second.
All right, Tracy made the motion to approve Minutes is corrected. Gary seconded. All those in favor, please say aye. Aye. And if you find it, you can just forward it to us.
I just want to see.
And then there's that one more thing for action item. That's, we talked about last week, we terminated that new, or
Yeah,
old contract
This is
and,
the cleaning.
yeah.
Okay, sure.
So the Penny had DHS write that up for the contract, but if you're in approval, I think she's gonna start on the 28th.
28.
And I had Rick Bramo look it over too.
Okay.
He was happy with her services prior to that, so.
This is item 7.
Yep, yep, they're in dire need of cleaning over there, so.
Yes, they are.
So whenever we have this building across the street, it's, who played that?
I don't remember.
Coach, we had a Barb Baldwin years ago would come into the Governor Sherman building and the DHS building. And we paid her through payroll by the hours. So it was kind of as a
Middle of
needed.
page 2 is what the hourly rate is. After the meeting, I'll get a hold of Justin and Rick to see what they found out on
A rough estimate on my COVID expenses is about 70 grand.
the AC
That's with,
units
if we include
over at the
payroll,
service center. This would be moved.
payroll stuff
What
so
they
far.
found out.
I don't know if you're gonna be able to claim payment.
Because I think
You'd be paying people anyways.
Nancy, didn't BC Cog say we'll get reimbursed for those
For
transportation?
transportation,
So-
transportation got a grant,
So I wouldn't probably put those in there.
yeah. And they told us to pay the average, and that they would pay us back from the grant.
So if you take out that,
Drivers, for part-time drivers, I had to go back and do like a 13-week average of their hours.
so that's about 23.6. So I don't know if it's gonna be worth the headache for 50 grand.
Don't have to wear this.
What?
Don't have to wear this.
No. I don't, you're far enough apart.
Motion to approve.
Okay,
Second.
okay. Gary made the motion. Tracy seconded to approve the janitorial contract for DHS services. Now, is that right, for DHS services?
Yep, after Benton County
Yep.
Service
For
Center.
Benton County Service Center?
Yeah,
For
I'll get your signature.
DHS services.
Department of Human Services.
Okay.
I thought that was for the whole building.
Well, it is,
Bill.
but this specific contract is for their services. We're gonna have to separate the line items for what she does for us.
Okay, all
But
right.
they need the contract to get their money back.
Okay, all right. So all those in favor, please say aye. Aye. Need that signed?
Yeah, but I'll get you later. I got a couple things you're gonna have to sign
Okay.
today.
All right. Well, it's 10:05. David?
Folks, I had a pending litigation matters to discuss with you this morning, and I would ask that you go into a closed session to discuss those pursuant to Iowa Code Section 21.5, Sub 1, Sub C. And I would like to make doubly sure that everything that links us to the outside world is shut off, including that camera.
Okay. I forgot that. It's back here then.
Well, we're not doing a Zoom right now, so
Okay.
I only use that for Zoom.
All right.
Is it on?
Is there a motion to go into closed session?
So
Yes.
moved.
Okay.
Second.
All right. All those in favor, please say aye.
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 Thanks. and I just kind of